Would like to warn our viewers regarding this next report, as it may contain visuals that might be offensive to certain viewers. World Thrombosis Day is celebrated annually on the 13th of October to raise awareness of the causal factors and the frequently disregarded and misunderstood condition of thrombosis. The disease affects as many as 900,000 persons in a year and kills 1 in 4 affected persons. News Centro's Adeshawa Odushoga has details.
When the human body gets a cut or a wound, the body naturally responds with a blood clot and, in a relatively complex process, gets coagulation. But with DVT, this is a bit different and it can be fatal. So what is deep vein thrombosis?
When the patient has maybe broken limb or surgery or one thing that makes the person unable to move a part of the body, especially the limbs, the patient is also exposed to that risk. Another thing is sitting for a long time. Once you sit for up to 3 to 4 hours without moving around is also a risk factor.
With deep vein thrombosis, there is a stoppage of blood flow to affected organs. Now, it usually would affect the legs, the thighs, the arms. These are the more affected blood vessels because it's within the thrombosis usually happen in the veins because your arteries normally would contract to move blood on its own, but the veins usually have other mechanisms to move blood.
Several factors may increase a person's risk of developing thrombosis, which includes age, overweight, extended periods of bed rest, surgery, cancer, and even pregnancy.
In pregnancy, we tend to see that the blood, the procoagulant proteins are elaborated more in pregnancy. They are higher, their levels are higher. It's not a problem because nature made it so because they are envisaging bleeding during delivery. Cancer itself can produce some proteins in the body, in the blood, that will make your blood more sticky. So patients with cancer are more at risk of developing thrombosis.
There are 1 in 4 people who die of thrombosis every year. Some of the symptoms of thrombosis include swelling pain and discoloration of the affected area, which could be arm or the leg.
So aside the lung immobility, there's also your body is clotting faster. So if I put the blood on the floor, I'm expecting it to clot within a certain number of time. If it clots faster, that person is at a higher risk.
There are 2 ways of thromboprophylaxis in the patient. We can do it mechanical and we can do it using the pharmacological agents. When I say mechanical, it's using something like pressure stockings. It works for some people, it doesn't work for some.
World Thrombosis Day is celebrated on the 13th day in October every year. The theme of the 2022 commemoration, Eyes Open to Thrombosis, emphasizes the need to be alert and recognize the early warning signs of thrombosis before it becomes worse. Adeshawa Odushoga reporting for News Central.
Dr. Chama Guinea at Aruba Family Medical Center now joins us on the news to speak more on thrombosis. Doctor, thank you for joining us on the news. How common really is deep vein thrombosis in Africa?
In the primary care setting, we may not see it as common as in the tertiary setting where those patients, but it's actually more common with people with already predisposing risk factors. So people that are staying, like we talked about earlier, people that have to stay for a long period of time for different reasons, stroke, paralysis, hospital stay following maybe an accident. So usually those people have the higher risk, but it can also happen also, or not as common as maybe outside, but yes, at least 1 in maybe 10 patients or yes.
What are the signs to look out for somebody that has never heard of the disease before? What should they look out for and quickly seek attention?
Okay, so what we would usually see, or it's usually leg pain and swelling, predominantly on the calf, that's like just below the knees at the back of your leg, and then on the thigh also. Then there can also be associated leg swelling, that's the foot will be swollen and heavy, but usually would have affect 1 part of the leg at a time. So there's swelling, there is pain, there might be redness of the foot, there might be itching, there might be change in color of the foot, it might become yellow, reddish purplish color or reddish in itself. So those are usually the constellation of symptoms that will come together for us to suspect it. But it's usually not enough to say, okay, the person has it. We will run some other tests. And
is the disease preventable?
it is preventable because when you're aware of what the risk factors is, you can do things to ameliorate the presentation of the symptoms. For example, if you have to be on a long flight, if you have to be on a long journey, we always advise don't sit for one place for too long at a time. Get up and move, move around. The pumping action of moving helps move the blood, so it doesn't stay in one place for too long, and then eventually lead to a thrombus formation. And then also for people that have other risk factors, we give medications to prevent or control. If there's any prevention, there's second prevention. So preventing before it happens, and then preventing when the earliest symptoms are really occurred. So we give medications for that also.
All right, Dr. Chioma Guinea, thank you very much for speaking with us on the news.
Thank you very much for having me.